All right, what is up? What is up? Welcome back to another episode of our Cal Cairo Live broadcast. Thanks so much for being here with us today. We have a special guest that had reached out to me saying, "Hey, I'd love to offer some content on your broadcast to your members. You could stream it on YouTube, all that kind of stuff." I'm going to let him in the room here shortly. But before we get started, I just wanted to remind everybody we've got some big events coming up. The Huntington Beach PI for All seminar, that's coming up on June 21st. June 21st, Huntington Beach. Hopefully there's the QR code. Great. Hope you guys can join us there. I've been checking out the venue. Incredible, right on the beach right there. So make a weekend of it. You know, the content's going to be incredible. We got a lot of good speakers. There's going to be panel discussion. Love those panel discussions. That's something that I think all events should start integrating more and more of. That really gives people a chance to interact, gives us a chance to talk about the newest, the latest, the greatest things that are occurring in the profession and any of these particular specialty sectors and things of that nature. So looking forward to that a lot. And then always, as always, we've been talking about our fall conference coming up in August. That is August 28th through 30th at the Disneyland Hotel. Disneyland Hotel, if you haven't had a chance to stay there, incredible property. The room block on that is going to sell out super fast. I've got my president's reception coming up at that event as well. So looking forward to that. Should be a great time at the fall conference, Disneyland, August 28th through 30th. So without further ado, I wanted to bring on today's guest. Let me see if I can get him on here today. There he is. I can see him now. How you doing, sir? This is Dr. Kent Choi. Dr. Choi, you see I got my Ichthus injury hat on for you today. Can you hear me okay?
Yeah, can you hear me okay?
Yeah, you're good. You're good, man. I see a little choppy, but the sound is good. So
Okay.
if you don't move around too much, it won't get too crazy. So hopefully, yeah, we can set it up like that. But I wanted to bring Dr. Choi on here just to talk a little bit about a discussion he and I were having in that, we've been trying to help support chiropractors in all of the different areas of chiropractic. There's lots of people out there who don't know where to turn, who to talk to. We want to be that resource for them. That's why we put on events like this PI for All event. That's why Dr. Choi and Dr. Kazanjian, who's the head of our PI committee, put together a bunch of scholarships for the PI seminar coming up in a few weeks. We still have 3 scholarships available. If you want one of those scholarships, make sure you join us next Thursday. You got to make sure you fill out the form. Maybe Tiffany can put up the QR code for the form. We'll get you registered for that special drawing. But we have 3 more scholarships for that event, particularly for new grads and students that are want to learn more about doing PI work. Because the conversation that Dr. Choi and I had was really about, why would new practitioners not want to get into PI, and what are they afraid of? Those kind of things. So, Kent, why don't you just introduce yourself real quick, and then we can dive into the subject.
Awesome. Thank you, Doc. My name is Kent Choi. I've been in practice for 25 years, graduated from LACC back in December 2000. My story with respect to personal injury, the first 15 years of my practice, personal injury was pretty miserable. Certain things lined up for me about 10 years ago where I met actually some very good lawyers and paralegals that kind of helped me understand a personal injury on a more holistic or A to Z level. Sure. And I think for the first 15 years of my practice, no one really was able to, maybe I didn't know, someone could explain things to me, but I met some very, very important people in my life that helped educate me on personal injury from the legal perspective. And then over the last 10 years, I've tied together a lot of the legal perspective and the medical perspective, and I've been able to formulate what's called the 5 pillars of a personal injury claim that involves working with reputable attorneys. And the last 10 years have been it's been very good. In fact, 95% of my businesses, I have 2 offices, one in Cerritos and Orange. Um, they just kind of naturally developed to be personal injury clinics, not by choice necessarily. It's just we draw a lot of attention, referrals from law offices, and we help these patients get better. Um, and I've worked really hard over the last 10 years after messing up for the first 15.
So are those 5 pillars something that we can talk about now, or is that something we should connect with you more about at the seminar, June 21st?
I would love to talk about it, but I think we can work that into our discussion once we get through the my perspective and obviously your perspective, since you've been in practice for a good amount of time. Um, and I'm sure everyone would want to hear your opinion as the president of Cal Cairo in terms of personal injury, right?
Sure.
Something that is part of your practice as well.
Well, give me a little idea, or let's touch on it right now. Why do you think people are concerned about doing PI work and are apprehensive, I guess?
Well, if you're a student listening to this, I think you may have heard through the grapevine. Maybe you witnessed it yourself. It just doesn't seem like a good fit for you. Maybe it seems a little bit shady, a little bit dirty. Um, Dealing with attorneys, a lot of people, I believe, they're not necessarily misconceptions. They see how terrible personal injury can be, and that feeling that they get is, you know what, when I get out, I'm just going to focus on sports or holistic chiropractic or something that just doesn't focus on personal injury. But every now and then they'll come into the office with personal injury and they'll do their best with it, but it's not something that they're passionate about. And that's fine. I mean, not all of us are cut out to be personal injury specialists, so to speak. Um, but I think a lot of it has to do with what you hear about and what you see out there. Now, there are some exceptions. There are 3 exceptions to the rule of seeing patients or not wanting to see patients in motor vehicle collisions.
Okay.
Number one, the magic word called MedPay, right? If someone comes to your office, whether they have an attorney or not, and they say, you know what, doc, I know you don't do lean work, but my attorney fully let me know that you can go ahead and bill my MedPay, and I have 5,000 MedPay.
Right.
So no business owner, especially a doctor of chiropractic, will turn away up to 5,000 MedPay. And that's rare, but that's why we wouldn't turn away a personal injury or car accident case. Number two, they don't have med pay, unfortunately, which is most of the time, and they pay out of pocket. They're like, you know what? I don't have med pay. I may be at fault. I may not be at fault,
Sure.
but I'm hurting. You're a good doctor. I've known you, and I'm going to pay you out of my pocket. What are you going to charge me? And you work out whatever's reasonable to make them better, as many visits as they need for a reasonable cash price. And the third exception would be someone doesn't have med pay, but they do have health care insurance that you're a provider for. So I believe that if you're a provider for health care insurance and they do pay sometimes for these injury claims, even though you mark on the insurance claim that there's a third party involved, some of these insurance companies will pay. Even though they know it's involved in, let's say, a motor vehicle collision. It's rare, but usually the number one is med pay and number two is out of pocket. Number three would be insurance, but insurance is tanking these days, so most people don't get too excited about collecting that small amount for from healthcare insurance.
And if they're not network with the insurance companies, also, then that's a whole different, scenario, right? Then that's where finding reputable attorneys to work with, in my experience, has been the most important thing, right? In terms of, can I work with somebody who has at least vetted the case, has at least looked at it and said, okay, there's a viable injury here, there's a viable claim. That's something that we're going to be able to, um, find help for the patient. Because as you've talked to me about in the past, it's about what do we do to help the patient, right? And one of the things that I think I remember the most, what we talked about last time was, Well, what are you going to do with these people who otherwise don't have any access to care, right? What are you going to do to help them? And I think that was an important that's an important lesson, right, to learn. So can you talk a little bit about networking yourself with attorneys and maybe even medical doctors, because I think that's another important piece of the puzzle when it comes to these personal injury cases.
Yeah, great question. Great question. So we would agree that other than med pay or paying out of pocket or healthcare insurance, most DCs will shy away from lien care,
Right,
right? Lien care meaning you're going to go ahead and have the attorney sign the lien. Your patient's going to sign that lien, and you're going to say, you know what, pay me later. And a lot of times, what happens is that later could be forever or never. And to add salt to the wound, being forever, which could be a year, 2, 3 years, the amount that they offer you is so low, it's almost it's kind of a miserable day for you, right?
right,
You provided $3,000, $4,000 of quality care 3 years ago, and they're offering you $700, and you're like, that's, and then you have to deal with confrontation, um, calling someone, negotiating. It just, most people don't like confrontation. And I think to answer why most DCs shy away from lean care is because they just don't want to have that phone call where there's a lot of ill feelings and just anxiety over dealing with someone that's trying to rip you off. That's what I think prevents a lot of people from doing lean care. Now, with respect to my dealings with attorneys, to put a little plug in for June 21st. I hope everyone that's on the fence is going to show up, but our profession has been influenced by some very good lawyers, but not.
oh, we lost him, I will add, part of what hopefully he can get back on here in a second, or maybe Tiffany can reach out to him and tell him that we lost him. A lot of people will shy away from lean care in many cases because you have to be able to have the bandwidth to carry or the cash flow to be able to carry that case, right? And so I've had some great experiences working with attorneys like Dr. Tim Gill. Um, in Santa Clara, we have another group coming out, Dr. Sean Steele and his group coming out to talk with us tomorrow night about how they do things in there, and they've been a great institutional sponsor for us at the association as well. So I'm grateful, to people like that. There's Dr. Mark Lazarus, who's going to, or I'm not sorry, Mark Lazarus, who's another attorney who's going to be one of our guests Thursday on the live broadcast where we give away money and are going to give away the scholarship. So I think one of the important things that I have learned and I've benefited from is being able to have the cash flow to carry lean care, right? And being able to manage, how many liens do I have versus maybe med pay cases versus self pay cases, all of that kind of thing. But I can't reiterate enough how important it's been to build this relationship with attorneys. And that's really one of the things that I've done to network myself with attorneys that I feel like provide scrupulous services, right? That have the patient's best interest at heart, that are willing to work collaboratively with us in terms of managing the case, in terms of sharing the responsibility. And that has become so important. Oh, I see Kent back here now. Hold on, let me get him on there.
So sorry, where did I lose you? I don't
Hold
know
on.
why I lost contact there, but let me just kind of recap. So sorry about that. When it comes down to meeting attorneys, most of us are petrified because we really don't know what to talk about. And to answer your question regarding, my relationship with attorneys, um, the overlying or underlying truth that everyone wants are three things, whether it's the doctor or the attorney or their client or a patient. If someone's legitimately having issues or hurt, they want, number one, great medical care. They want great medical care. And yes, on a lien because they weren't at fault and they want to get treated and not have to go broke paying doctors along the way. The number two thing that everyone wants is they want to make sure that if they're injured or have complaints, we don't leave anything on the table. We basically document and work together to help that patient get the comprehensive care that they need. And the last thing that we all want is we want to make sure that these cases, because they're limited to a certain amount of coverage, in other words, Not everyone that comes to our offices are like, oh, I just got rear-ended by a FedEx truck. Not happening. It's
Right.
usually I got rear-ended by someone with no insurance, and my own insurance doesn't have underinsured or uninsured motorists, and that's code for there's no money to pay anyone for anything. But
Right.
a doctor that understands how this works on the insurance side, which I think as a business owner, it's important. If someone gets rear-ended in your office, and let's say they don't have a lawyer, but they're simply your patient or my patient we've known for 20 years, they're like, Dr. Theater, I just got rear-ended. You know I don't like lawyers, but the person that rear-ended me had no insurance. They gave me this expired card and they say, oh, I don't have insurance. Now, whether that's true or not, unfortunately, it happens a lot. And then you ask your own patient, well, there's something called uninsured motorist bodily injury. Do you have it? And then you obviously have your staff take a look at it, and they have $50,000 uninsured motorist bodily injury. And so now you're going to be able to treat that patient and hopefully connect them to an attorney because there's no med pay on that policy. And you're going to try to convince that patient the only way that you're going to be able to get care on a lien is if it's done on a lien and there's an attorney that represents you, because your own insurance company is probably not going to pay $50,000 by you making a phone call and submitting medical records and bills, because they know that you're kind of naked. In other words, you're not protected in any way, shape, or form. And even though they have a duty to pay up when you're injured, they tend to lowball even their own clients that have been paying good health, good auto insurance premiums for 20 or 30 years. And so when we talk to attorneys and say, we want to work together to help these people that are hurt by providing great medical care, making sure that we don't leave any complaint or injury, we don't miss out on any of those things. And we also understand that from the business side, there's not $1 million or $5 million in every claim. We want to make sure we get everything we can for the patient, knowing that there's a limitation on coverage. So we don't end up getting $500 on our $5,000 bill.
I
Now, we
wanted
don't
to
talk
ask you a
about that with the
question.
attorneys.
I wanted to ask you a question real quick, based on what you were just talking about there. Have you had the experience where, say someone comes in and says, "Oh, well, I don't have med pay, and I don't. There's nobody to cover a third party to cover that," and then they're coming in basically as a self-pay patient, and then they realize after the fact, maybe a week or two into care, they have that uninsured motorist bodily injury, as part of their policy. Have you encountered patients like that? And if you have, how have you handled it?
Yeah, it's a very complex question, but an important one. If they're paying you cash, and let's just say they don't have med pay and they're not interested in making a claim, they're just hurt and they want to pay you out of pocket.
Right.
Um, Unfortunately, if you have those bills paid and you've submitted that, or you have no recourse, meaning the complex question is like, what do you do when someone's paying you your cash rate? And then now there's actually an insurance company that says, hey, just send us your records and bills. You have 30,000 uninsured motorists, and the car, let's say, is totaled or maybe a significant crash, when they know they're going to have to pay. Your duty as a medical provider is to help that patient and get paid for your services. So if you already got them to pay you $100 a visit for the last 20 visits, and then they have that epiphany that says, oh, my own insurance company is saying submit my medical records and bills and we're going to settle with you. Well, if you ended up having them pay $100 a visit when your treatments were valued much higher, but that was, let's say, a 50% cash discount, you're unintentionally going to harm the value of the claim, because now the insurance company will say, yeah, we'll pay you the $100 a visit, but we're not going to, and we're only going to pay you $100 a visit for maybe a few more months. So they're going to offer your patient maybe $2,500 all in, when you know that
So
they're hurt
you
a lot more than that.
so will you discuss that with the patient prior to them, accepting your care recommendations, or is that something that you just kind of let unfold typically as time goes on?
That's a very great advanced question. So what I'll do is, what I teach doctors that reach out to me for advice, I say, you need to stay cool, calm, and collective. You need to learn how the insurance companies work. You need to know that if unless you're hurting for that cash, and you know that there's a potential lawyer to be involved, or you know there's no med pay and maybe the other person has insurance, or you don't know whether or not your patient has uninsured motorist, because the first visit you shouldn't be talking about that stuff. What you need to do is say, I'm going to help you out today. And then and they're like, what about payment? Say, you know what, let's focus on getting you better. And then on your next visit or in a few visits, as I'm helping you out, we'll talk about different options. My staff will explain that to you. Or if you want me to explain it to you as a business owner, I'll be more than happy to have that discussion with you. I tend to be very type A about being a business owner. So a lot of patients look to me for my expertise. And so, not to say that I don't trust my staff, I think the business owner would be the right person to have that discussion, to help them get the care they need and do it in the right manner where everyone wins, right? The medical provider, whether it's you or other places like MRI centers or pain management doctors, can take care of that patient on a lean, and your bills can be paid on a lien, which is more than the $100 a visit. It's a great conversation to have to explain to that patient who otherwise has no idea how it works. So, because I do about 300 to 400 cases a year, and I've probably done, gosh, if I had to count, I've probably seen cases resolved from beginning to end well over, yeah, well over 2,000, maybe close to 3,000 cases. There's very few situations where the cat's got my tongue. There's very few situations where someone's sitting in front of me, they're presenting a certain way with a certain insurance situation, and I'm just scratching my head. I mean, anything can happen, but the more experience you have doing personal injury and running into these situations, the more comfortable you're going to be in your skin. And I feel pretty comfortable.
And that's one of the reasons I like what you've been doing, or what the PI committee's been doing for all of these years. Is it's really providing a platform for people to understand these scenarios better. And I kind of prompted you with that question, knowing what I do in my office, and just kind of wanting to hear how you handle it. And we handle things very similar. And I always just approach it from the educational perspective to try to help people understand what the landscape looks like, when it comes to personal injury work and the personal injury environment. So, but I do want to shift gears a little bit and talk about more the treatment side of it, and sharing the responsibility. That's another thing that I've learned a lot about over the years. I just met yesterday with a pain management specialist who is really focusing on PRP and stem cell injections and things of that nature. And I think it provides a unique opportunity for chiropractors to work collaboratively with medical doctors and share the responsibility. So, can you talk a little bit about how you share the responsibility when it comes to personal injury cases, and how you kind of quarterback a case in some sense?
Yeah, so great question. I think 90% of the cases involve chiropractic care, MRI testing, and pain management at some point. I think that's 90% of the cases that come through,
Yeah.
especially the spine case, right? Neck or back. Of course, if someone has shoulder, knees, hips, maybe a concussion, or something that requires a referral to a neurologist, a psychiatrist, a neuropsychologist, an eye specialist, an audiologist. I certainly have developed relationships with doctors of audiology, doctors of optometry, medical doctors, neurosurgeons. I've connected myself with many, many of these providers to help the patients get the care that they need. So, with respect to relationships with other providers, personal injury seems to be the only way that I can foresee us as chiropractors being able to connect with the medical profession. In fact, if we go to the PI for all on the 21st, I think there's going to be at least 15 or 20 non DCs there, maybe
Wow.
pain management, neurology. I think there's going to be a lot of MDs there at the event.
That's awesome, man. Because I think what do you what would you recommend to our new graduates, our new practitioners, to do if they want to work more collaboratively with medical doctors? Do you have any strategies or tactics that you used early in your career?
Yeah, that's a great question. I'm going to go back 25 years. When I started my practice, guys, I started by renting space in a medical doctor's office. I was
Ah,
actually integrated in an MD office. So I'm one of the few chiropractic doctors that, like, I've met more MDs in the last 20 years than chiros. And I'm just comfortable around them, which is very rare for chiropractors. And not that it's a good or bad thing. It's just ingrained in me. And to answer that question, when I worked with the family physician that I still work with now, and I send him business, he sends me business, PI and non-PI. I would ask him, I'm like, hey, who's the best? Who's the best person you have in this? Because he's about 10 years older than I am. So he's had 10 years of keeping a Rolodex of all the specialists. So a great place to start, whether you're doing PR or not, just to expand your referrals, is asking your family physician or any family
sure.
physician, who do you like in these specialties, and then maybe even arrange a meeting or just send business that way, and let the patient know to make sure they tell them, hey, my chiropractor sent me to you because uh, my family physician reached out to the chiropractor reached out to my family physician, said who's the best, and they said that you're the best. So it'll come full circle in a positive way if we work in that manner to connect with MDs.
Man, I love that because I have seen firsthand how that's helped, been a blessing in my practice and helped build my practice. And it really, for me, just came from the perspective of like, hey, I need to get this person some additional help. We've got a torn rotator cuff, or like you said, some sort of concussion symptom that's not resolving. Who can I get this person to that will take a lean, that will work collaboratively with me? And in doing so, I've built a lot of relationships with medical doctors here in the Santa Clara County that now refer me patients, because I look as the support is a two-way street, right? And so it's been really rewarding in that regard. I mean, you got to do your homework and you got to know your stuff. Make sure you've done your anatomy. Make sure you know how to handle these cases, all of that kind of thing. But it certainly can provide a path to more cooperation, more collaboration. So, anything as we're kind of finishing up here, Kent, that you want to share last couple of minutes, or how can people connect with you?
Yeah, my cell number, I'm 24/7 with my cell, 714-606-5330. I do teach all medical providers that want to learn more about personal injury, whether you're a neurosurgeon, physical therapist, acupuncturist. I offer just a free consultation. Let's just chat about personal injury and see if it's the right match for you. And then obviously, I have a network that I educate with 4 webinars a week, and hopefully, and we're going to be a sponsor over at the Cal Cairo events as well. It's just a good way of having an opportunity to find out if PI is the right thing for you. But it's a pretty extensive program. We've probably done over almost 1,000 calls or webinars so far. It can be overwhelming, but if you're really passionate about understanding personal injury from A to Z, I do provide the education and the connections that might inspire you to do good in this area that most people shy away from, which is personal injury lean work.
I love it, man. Thank you so much for being on. He's not joking, you guys. This guy will text me sometimes at like 10:30, 11 at night saying, hey, what do you think about this? So, and I'm like that too. So I try to get back to you as fast as I can. So before we finish up, just want to remind you, coming up in just about a week and a half, Huntington Beach, PI for All, incredible location, fantastic lineup, super good opportunity to network. There's a panel discussion, all that kind of thing. So make sure you join us if you can. And thanks again, Kent. Looking forward to seeing you guys next or on Thursday, actually. So take care and talk to you soon.
Thank you so much.